Dr. Mike LeNoir, and this is the Wellness Watch. Good health and welcome to today's edition of the Wellness Watch. A very special opportunity for us today. We have Dr. George Wood, MD. He is the Chief Scientific Officer for Crestwood Behavioral Health. And more importantly to me, he is a consultant to the African American Wellness Project. Dr. Woods, thank you so much for joining us.
Thank you, Dr. LeNoir, for having me.
All right, Dr. Woods, we know that this pandemic has put a lot of stress on all communities, and especially I've seen it in the African American community. How has the psychiatric climate, the environment changed because of this pandemic?
For the worse. We clearly know, Dr. LeNoir, that environment is the number one factor in the creation of mental disorder. And certainly in the last 10 or 15 years, that's become increasingly clear, trumping even genetics, trumping even some things that we thought were much, much more important. But environment is really, really the factor in shaping psychiatric disorder. So if you think about what the virus has done to our environment, it has isolated us. It has kept us, in many ways captive. I didn't see my grandkids for 8 months. And then you can see how that environmental hammer would in fact increase even mild mental disorder to a much greater extent. Aside from the purely psychiatric component, you've got the neurological component. We know that people have developed long hauler's disease, which is the symptoms that occur after the infection is gone in COVID. And many of those symptoms are neurological. Poor memory, what we call brain fog. Approximately 30% of those that have this long hauler's disease have neurological symptoms.
One of the things that we are dealing with consistently here at the African American Wellness Project is we believe that vaccinations make a big difference in terms of outcomes and in terms of disease specific symptoms. You talked about the long hauler disease. I just saw an article yesterday that suggested that that's the result from an effect of the virus in the spinal canal.
Right.
So since that has occurred, what is the psychology in the African American community that's unique in their opposition to vaccinations?
The psychology is, as a friend of mine in Alabama says, you have to be trustworthy in order to have trust. And there are not only African Americans, but others that really are concerned about the trustworthiness of our medical system, certainly our psychiatric system. And so that trustworthiness cannot just be ignored. It can't just be trampled on in the name of even a good science. And we know that vaccines are the best science. So we really had to evolve in our approach toward getting everyone vaccinated. And let me just say, we need everyone vaccinated. We really have had to evolve our approach from one, you got to have it, you got to have it, you got to have it, to let me listen to your reasons and let me talk through those reasons and let me be honest with you about that history, the Tuskegee experiment and others, where public health showed that they did not care about the African American population.
We're talking about the coronavirus epidemic with our special guest, Dr. George Woods. We'll be right back after this break.
Life has really been changed by the COVID-19 pandemic. I know that you are tired of social distancing and wearing masks, and you want to gather with family and friends. But you know who isn't tired? Coronavirus. Get vaccinated, please. This message is sponsored by the African American Wellness Project and the Alameda Alliance for Health.
But we've had a lot of information out there about the efficacy of vaccines. Yet we still see, in spite of the death rates and the others issues associated with the impact of this viral infection on African Americans. What do we need to do to turn this around from just a conceptual mental health point of view?
Well, I talk to people every week. I do different podcasts every week, and where we live here, my wife and I, we live between two homeless shelters, and I visit those homeless shelters every week. Talk to people, try to explain to them, let them know that there's vaccines that are out there that are available. Um, but it's really a function of listening, Dr. LeNoir. We're not going to be able to shove this down their throat. And what I'm seeing over time is as we are able to listen to people and as they're able to see that people really do live with the vaccine and die without it, we're making a significant dent. But it's a tough call. I don't want to imply that I've got any answers up to that.
One of the things that we're most concerned about is the vaccination of children. That's going to be an even tougher call. What do you think we can do that makes that discussion a little more relevant? And let's broaden that discussion a bit. When we start to look at who's talking to the African American community and other communities of color, it's often people who are not from that community.
Right.
It's often people well-meaning and professional and experienced people talking from a white perspective,
Right.
minority communities or people of color. What advice do you have for them as they try to explain and discuss the whole issue of vaccination, trust, all the things that you brought up? What do you tell them? Are there some tips?
Well, I think, the first tip for me is to make sure you talk to your own community first, because I think these are cultural issues. These are cultural issues. And the point you just made, Dr. Nenor, in terms of them not being from the African American community, I think that's a class issue as well as a race issue. And, I think that it's important for us as African Americans to make sure, and particularly as African American, quote, experts, unquote, to make sure that we enlist neighborhood communities, folks, to have this conversation, not just the doctors, not just the psychologists, not just the psychiatrists, but the folks that are in the community that are impacted to such a great degree, to make sure that we're able to provide them with the information so that they can provide us with the entrees to ensure that people will listen to what we have to say.
Well, we have a philosophy that we're just going to keep talking because we know that after a while things get old, and the money for discussions with minority communities and health equity, that all kinds of bounces back to where it used to be, and it's not a permanent solution. So we at the African American community are determined just to keep talking, not to be judgmental, not to be negative, but just to keep talking about the facts as we perceive them. Let's broaden our discussion just a bit.
Sure.
To talk about the engagement of the African American community with the general psychiatry community. There are always two dynamics. One is what's going on with the institutions themselves that deliver the services. The other is what are we doing, and what are the cultural norms in our community that make us acquiring psychiatric services so difficult?
Well, it reminds me of a story, Dr. Nora. I was probably about 2 weeks out of my fellowship, and I went into a jail to see a young man that was very, very ill, that was supposed to be a gang member. And as he and I were talking, I slipped into, as they say, the vernacular. I slipped into a conversation. I tend to have a bad mouth anyway. I try to watch that, and probably said some things that I shouldn't have said. And he looked at me and he said, "I'm surprised you talk like that." He said, "I expected more from you." And it was a lesson that I've never forgotten, because it really showed me that race isn't enough. Really having an understanding, the true humility for those that we serve as providers of care is very, very important. Race isn't enough. And that is certainly true when we talk about both, as we talked about the COVID, but certainly psychiatry. Being trained as a psychiatrist, having, a dark skin isn't enough to reach people. Um, because if you don't have the humility and you're not willing to listen to them and understand what they're trying to say, because we've all been trained by the white institutions. There are very few of us that have been trained by institutions that reflect our color, and we've all been under pressure by the white institutions, even those that have been trained in institutions like Meharry, etc. But we've all been trained by the white institutions, and it's very important that to understand that we, no matter what our color may be, we're bringing white psychiatry to the masses, and we need to straighten that out.
Yeah, that bleeds into the whole system of unconscious bias.
Right.
Tell us about how that plays out in the field of psychiatry in your experience.
Well, and this is my own bias. I have some issues with unconscious bias. I really do understand how important believing that people may not be aware of their biases, and therefore we have to build structures around them to make sure that doesn't impact us. I think unconscious bias is a great paradigm when we're talking about juries, for example, or certain institutions. But I like upfront bias. I think there's enough upfront bias in medicine, and we've seen upfront bias in medicine over the years to be able to deal with it in a straightforward manner. Now, I'm one of those people that wish the South Carolina had left their flags up because I want to know where you are.
One of the that's a good analogy. One of the things that happens with African Americans, at least from my reading, I'm no expert, is that your institutions and psychiatry are very quick to treat African American with medications.
Correct.
And African Americans, I think, among the ethnic groups are probably more suspicious of medications than probably any other ethnic group. Tell me how that all plays out.
Sure. There's a branch of psychiatry, actually pharmacology. My fellowship is in psychopharmacology, and when I did my fellowship, I focused on two branches. One is geriatric psychopharmacology, and the other one is ethno-psychopharmacology. And many people, even experts within the medical field, are really unaware of the fact that there is a subspecialty of pharmacology called ethno-psychopharmacology. And there are things that we know about different races and their enzyme metabolism of the liver, the fact of what they eat. For example, a first generation person from Japan or from Vietnam really should be prescribed about 1/3 the amount of medication than someone that may be second or third generation. African Americans metabolize medications at a slower rate than other ethnic groups. So these are things that we know about that have been proven scientifically, and yet they are very rarely included in treatment. They are often used in research paradigms, but they're very, very rarely included in treatment. One of the other things that's unfortunate, but is also true, is that cognitive impairments, and when I think of the one I'm thinking of particularly is fetal alcohol, is rampant in our community. If you look on our corners, we have unfortunately as many liquor stores as we have churches, and not everybody with fetal alcohol presents in the kind of classic way of having unusual eyes or unusual lips. Often people that have along that spectrum may just have cognitive impairments that we are not aware of. But none of this is really looked at so often in our training, and particularly in our approach toward African Americans and other people of color.
These things are always a two-way street, aren't they? Tell us a little bit about what you encounter from the African American attitude toward just mental health treatment and therapy, especially psychiatry.
Well, what do I encounter? I encounter mistrust. I encounter, it seems like, certainly, Dr. Noor, when we focus on our history as African Americans, we so often focus on the most egregious components of our history because we, and much like the Holocaust with other groups, we never want to forget the most egregious components of our history. And yet those egregious components, like, the Tuskegee experiments, or the fact that the woman that developed, was first involved in Johns Hopkins for stem cells, was never given a penny of the money for that. That becomes our entire history. And so now to be able to talk to African Americans about other parts of our history where we really have been actively involved in developing, really excellent treatments. The fact that an African American psychiatrist was one of the first persons involved in the identification of Alzheimer's. Those are lost. And when those are lost, all that occurs is the mistrust, the fear that the Tuskegee experiment can occur again.
We're talking about the coronavirus epidemic with our special guest, Dr. George Woods. We'll be right back after this break.
I'm Delroy Lindo, and I had the coronavirus. So I know from personal experience how devastating a coronavirus infection can be. Now, fortunately, I fully recovered, but I don't want anyone to experience what I went through. We're living in very dangerous times. On many levels, our communities are under siege, under attack. You know it, and I know it. Now, in the face of that, we need to help and support each other wherever and whenever we can. One of the ways we do that is to get vaccinated against the coronavirus. That protects you, your friends, and your loved ones. With everything we're facing in today's environment, please get vaccinated. Ensure that our communities remain strong, healthy, and well. Thank you. I understand the hesitancy and the resistance that some folk may have to taking the COVID-19 vaccine. And you absolutely have a right to feel hesitant. But COVID is real, and I know from firsthand experience. I had it. I wouldn't wish COVID on anyone. I've fully recovered, but I don't want to ever be that sick again. You and all the people that you love are at risk from COVID-19 infection. So please get vaccinated for yourselves, your family, and your community. Thank you.
So how do we overcome the stigma that's associated with mental health treatments in the African American community? People are always talking about, you're so crazy, that, and when you start to talk about mental health treatments, people feel that, well, this may mean that I really am crazy simply because I may need some help, or I may recognize people in my environment who do need that help.
Right. Dr. Noor, one of the things that I think is so important when we talk about mental health in general, but certainly within the African American community, is that we realize that we want to talk about mental health, not mental disorders. Many people within the African American community, of course, are not schizophrenic. They are not bipolar. They do not have serious mental illness, but they do have problems that can be addressed. They do have problems that need to be addressed in order for them to function effectively. And I think that's really where the whole question that you brought up earlier in terms of unconscious bias is so important. People in the African American community have been traumatized. Trauma is a baseline in our community. And when I, evaluate people, I look to see what that trauma is all about, because it's just tragically, it's part of our community. but it's also something that you can talk with someone about. It's something that you can commiserate with them, and you can develop a relationship that is based upon their needs rather than your science. So I think it's important to train experts, people that provide in what we call trauma-informed care. And that's one of the things that I really want us to continue doing in the African American Alliance, is to continue with trauma-informed care, to really develop an understanding of how people are traumatized, the ways in which they can still function very effectively through that trauma, and yet it undermines them and creates problems with their tendencies.
Now, you are the chief scientific officer for a very large conglomeration of mental health facilities. What changes have you made in their approaches to the care of people of color?
Well, let me just say that my first 7 years of training from 1983 to 1990, I worked at Crestwood, and I worked as a psychiatrist, and I was stunned by how they treated their people as opposed to how I'd learned in medical school. I came back 2 years ago, and what I learned at Crestwood is that they're not a medical model; they're a psychosocial rehabilitation model, and so consequently, things like trauma-informed care is part of our model. You know what I mean? We celebrate, to the extent that you can celebrate Black History Month. We certainly acknowledge it. I'm not sure there's something worth celebrating all the time, but we certainly acknowledge Black History Month, and we do something about this. And some of the things we do that may not seem as though they are aimed toward African American populations, but we have 7,000 clients. We have 30 facilities. We serve a heart healthy diet throughout our entire facility. We make sure that the clients in our facilities, those we serve, we really look carefully and do assessments for cognitive symptoms, for other types of symptoms that we know African Americans and other people of color we have. And we also really work to make sure that our staff reflects our population.
So I think that's probably more than many facilities have done. I think to a certain extent, the mental health community has a very big job to do. And often it's criticized, really probably unfairly, for outcomes that sometimes cannot be predicted. And so I think therein lies one of the problems that we have in this country in terms of people accessing symptoms, accessing services. One final area that I think is really important for us to discuss is the whole role of violence in our society. I mean, obviously, the numbers are not always clear, that things are much worse, but it just seems to me that there's far more violence now than there was before this pandemic. Is that just a perception, awareness, or are we seeing a real phenomena, and why?
Well, let me move back for just a moment, Dr. LeNoir. I have to say, and again, this is my own opinion, I don't think that it's unfair. I think that it may not be totally accurate, but I think that as mental health professionals, we have a greater responsibility than we have chosen to fulfill. And I think people have every right to expect us to fulfill that. And as far as violence, you know, the 1960s and 1970s are much more violent. The 1930s and 1940s are even more violent than those periods. So the periods that we're in now, except for this uptick from about 2019 through the pandemic through today, is really not the most violent period in American's history. But what it is, it's the most gun-laden period in American's history. Right. So when I think about violence, I think about gun violence, and I just don't think about homicides. I think about suicides. We have more suicides secondary to gun violence than any other country, as well as the homicides. So I lay it solely at the feet of gun violence. That isn't to say that the trauma that people have experienced, because trauma will make you feral. And when I mean feral, I mean like the feral animals that only take care of themselves. You see a group of foxes, and those baby foxes, they don't necessarily take care of their other foxes. They're feral animals. They only take care of themselves. And I think that the trauma has done that tragically for our inner city communities. It's made people only want to take care of themselves. However, if you didn't have a gun in your hand, it would be a much, much different circumstance than what we see today.
Any suggestions for the society as I mean, this is a big responsibility, but for the society as it relates to changing dynamic about vaccinations, to changing the dynamic about homelessness, to changing the dynamic about violence?
Yeah, I'm hopeful, Dr. Noor. I really am. Maybe it's because I'm a Capricorn, but I'm hopeful because I think the pandemic tore the patch off of the social determinants of health. I think it tore the patch off the fact that um, in dementia, even though African Americans have a significant higher prevalence of dementia, we're in very few of the clinical studies. The fact that up until 2008, many clinical studies for depression did not have women in them because they didn't want someone that could get pregnant and mess up their studies. And so I have real hope in this younger generation, as well as people like you and organizations, not just this organization, but the other organizations that you have started and really created. I have real hope that that the pandemic will have a good turnout. But we've got to determine, as a friend of ours, John Burris, says, that this is a movement and not a moment.
Dr. Woods, thank you very much for joining us. Obviously, you will be leading the initiatives that the African American Wellness Project puts forth in terms of trying to solve some of these issues of vaccination and to keep talking to the African American community, not only about this whole pandemic and adjusting to it, but about the need to be able to access services for mental health when you need them, recognizing them in yourself and in your family. So I think this discussion goes a long way toward helping us to understand these dynamics. And thank you so much for taking the time.
Take care.
Well, thank you, Dr. Woods, for that splendid discussion on the impact of the coronavirus pandemic on the mental health of people of color. You can also catch our program on our podcast, Black Doctors Speak. That's Black Doctors Speak on any podcast channel. Good to know from Dr. Woods that the healthcare system has a lot to learn to effectively deal with people of color. And we as people of color have a lot to learn about how to engage effectively the mental health system. As we always say, health is your biggest asset, so protect it. I'm Dr. Mike LeNoir.